I am the Linkage to Insurance Manager at the Alliance for Positive Change. I've been there about 5 years, and we are an organization who has been in business for over 20 years, assisting clients that have chronic conditions. We provide case management, food and nutrition, a lot of support group services as for men, or it's inclusive for women. And we also have creative writing, processing, housing facility. So just in that type of work the people that I'm around there, um, this example of self-determination is something that we do every single day with assisting our clientele. And of course, in my own personal life as well. As Jamie mentioned, I was a participant in the Be the Treat process, and now as a sewer and as an alumni in the leadership role. And it's been a great journey to be perseverant in all the things that I'm doing right now, like just being today, saying yes to this, is also a way that I have been able to change and just be more proactive and revolutionary in the things that I've done and kind of taken away that fear. So I'm really happy to be here on this day about self determination. And with this health insurance piece, it is also something that I have always been a champion for, like I said, an advocate for the people that I am working for. If they do not get health insurance with one of these plans, then I'm helping them with getting another option. And just the fact that this health insurance is something that a lot of people are not aware of is available, that they can get coverage. And we definitely don't want them to miss out on this opportunity because right now in this pandemic, we know that it's a challenging time. Food is a priority, and there are a lot of people who are not getting that. So for health, for me, it's an essential thing. Of course, if anyone gets sick, they need to have this full coverage. So I don't want someone to think about, do I not go to the doctor because I don't have coverage because I need food on the table? And with this information today, I hope that it will alleviate those fears, especially for the immigrant population who is here and out of a job, a lot of them therefore cannot afford health insurance in some sense. So I hope that not only with the immigrant population, but anyone who is living within New York, that they are able to know that it is possible for them to get health insurance. Some of it may be free or low cost, and some, depending on the income, may have some type of fee that may come to it. But just to know that the possibility is there is what I hope that everyone kind of goes away with today. And so we can start the presentation. So as the Alliance, our linkage to insurance team is consists of 5 of us. And our goal is to enroll or to re-enroll anyone who is uninsured. They may have a small business, so even the bodega stores, they are eligible to apply as well. The nail salons, share this information with them as well. So we kind of let the uninsured go through the enrollment process through the New York State of Health Marketplace. That is the first step, and it could be anyone else, also families, anyone under the age of 64. Consumers enroll in Medicaid, Essential Plan, and Child Health Plus all year round. But right now, there is a special enrollment process, and that is mostly for those who are under the qualified health plan. This enrollment period, as you see on the screen, is from November to January. However, due to the pandemic, they kind of kept it open from March on to now. But right now is crucial because those who are under the qualified health plan, which means that's a fee that you may pay based on your income, they are the ones that needs to enroll right now because after the marketplace closes, they may not be able to enroll through the New York State of Health. However, they may get insurance through HAC, which is another platform that I'll talk about later on. So what is important to know is that because this enrollment period is open, it means that health coverage can start January 1st. So that means if you call me tomorrow you can get health coverage starting tomorrow, on January 1st, sorry. So this is why it's so important for everyone to share this information with your family, friends. Like I said, if you're going outside to the supermarket, anyone share that coverage can start soon, because there are some people who, like we said, is still uninsured and thinking that they have to wait a long time. The insurance process is not that long to complete the applications. So this process can be move along quickly as long as you have all your information that I'm going to go through as we conduct the presentation. Next slide, please. So our main focus for this group of population of homeless people, we know it's very hard to, they may not have address, so that may be a concern for those who may not have an address, but that's okay. We have a way that we can still get insurance if you lose all your identification. Substance users, same thing, may not have a set place that they have. Anyone who's Asian Pacific Islanders, immigrants, people of color, those living with HIV, and anyone within the LGBTQ plus individuals and their families. Anyone, as mentioned before, who's under the age of 64, and if they're not eligible for the New York State of Health Marketplace, then they will be referred to the HHC New York Cares for further assistance. Next slide. So as the enrollment, as I mentioned, it takes about 30 minutes or more to determine your eligibility. So that means if you have all the information, your demographic information, your date of birth, your social security, or if you don't have a social security, that's also okay. You don't need to have a social security to get health insurance. As long and financial information, that's the one of the main things that we need. So if you have that information of where you're working, the address, what it costs that you're getting every week or every month, that is something that you need to have for me so that the application process can move along quickly. But if it doesn't, if you don't have that, then we can pause for you to locate that information. And even if it means another day, couple of hours, you need to come back to me. It's fine. You can call me back and we will pick up where we leave off. But that these are things that makes the application move very quickly if you have these items. Anyone that you are going to put on the application. So if in your household you have a dependent, you could put them on the application. And so you will need their information as well. So date of birth and their social security. That's the only thing. If they are working, then we do need their financial information as well. But once again, if they don't have Social Security, it's okay. The whole entire household can not have Social Security and they can still get health insurance. The only reason that the New York State of Health asks for the Social Security information or social is because they want to know what tier of health insurance you need. That is the placement. That's the only reason why. Your information, other than that, does not get shared with no other governmental agencies. And that's actually a protective bill of right for the patients as we come to the end of the application that I have to make sure I read, or the patient can see, or the client can see themselves, that it states that none of the information that we're asking goes to any other government agency. So nothing to do with immigration or anything like that. So I just want to be very clear with that. So once again, all that information, once you have it at the tip of your hand, it can make the enrollment process move so smoothly. 30 minutes at times, or like I said, it will be a little more to determine the eligibility. And you get the eligibility, I want to say 90% of the time, right after we complete the application. So that means 30 minutes it takes me to complete the application, you will get a determination on were you accepted into the health insurance and what health insurance you are qualified for. The only reason you may not be able to get a determination is, for instance, maybe something in the application they couldn't locate properly. So let's say for some folks, they may have been over down at HRA, for instance. So some of your information may be different from what you're sharing with the New York State of Health, and that's two different entities. So if they're trying to locate who you are, because they do an identity proofing section, if you do have a social security, for instance, that is something where it might say, okay, we need more time to review the information that you sent to us. So they may request additional documentation, probably proof of income, maybe the location of your business that you gave, they couldn't locate the information, so they need more time to look into that. Um, so they may tell you we need additional proof. And so with that, at the end, it's still telling you what they need from you in addition to provide the determination. So that may take a day or two for them to provide the answer, but that's because they're waiting on you to provide the additional source. And the document that you give, that takes anywhere from 1 to 10 business days for them to review. So it may take that length of time if they need to give the accurate insurance plan that you may be eligible for. But once again, that's still okay because they're giving you grace period. Sometimes we know folks need more time to locate their past pay stubs or tax information. If you're a small business owner as well, you know that it's in itself is different in terms of you may want to provide tax information, or you may want to provide your last 3 months of your expenses for your business. So that may take you a little more time, and they give that extension to for you to provide the documentation. And sometimes too, they may ask for a proof of your citizenship, for instance. Once again, they may want a birth certificate or a passport. That's still because they want to determine they're putting you in the right eligibility for the insurance plan. So all those things, once again, it's all for the right insurance plan. And the documents, for instance, for those who do not have, remember I said homeless people, or it could just be someone who's moving around, or you lost your all your valuables, you can still get insurance. The homeless person I've helped, they still got insurance even though they didn't have an address. There's a particular thing that we do where I can put in, for instance, the nearest post office that you go in the area. So if you tell me the area that you go to often, then I can find the nearest post office that's near there, and I can send it there, and they can still receive their health insurance card and all their health information that the New York State of Health is going to provide. um, and what the insurance plan is for that one is emergency Medicaid. So emergency Medicaid is going to be only if the person needs emergency. So going into an emergency only, and it has to be the doctor has to be the one to determine that what you're coming there for is an actual emergency. So that means you can't go there to ask for a for the dentist. Nothing that's not an emergency. Please don't show up and say I have, I don't know, something is wrong with my finger, or I have a headache. It has to be an emergency, as I mentioned. But that is the plan that you would be given if you have no documentation. So that means no address, no social security, immigrants, all your documents is expired. You've been here 10 plus or 20, 30 plus years, everything is expired, you can still get that insurance coverage. If you do have a little income, wait, hold on, let me go back to that. And that portion, your financial your finances, sorry, has to be under 17,000 to get that emergency Medicaid if you are an immigrant and have all expired documentation. If your income is above that 17,000, as I mentioned, then you go into a different tier. And the next tier is called an essential plan. So the essential plan are for anyone who has income a little above 17 or a little or under, of course. So you can't have more than about 25,000 for that essential plan. And now this is for everyone, whether you have a social security, you are a citizen here in New York or it's the United States, or you're an immigrant. As long as you have that criteria, you can be bumped up to essential plan. So the essential plan means you get full coverage. So that means you can go to the dentist, You can go find out about if it's just a headache you have and all the minor things that you need assistance to getting a primary doctor, basically. You can have that plan. Now, for the immigrants in this section, you need to have a valid visa and an I-94. So that means this tier, your items cannot be expired. That's what that means. So you come into the country, and I don't care if you just got here today. You can give me a phone call right now, and you can be insured as soon as we complete the application. So that means the 30 minutes, like I mentioned before, right? 30, 40 minutes that it takes to complete the application. As you land in New York, you can get insurance. Doesn't matter, even if you're visiting. So you guys are, a lot of folks are still traveling. So someone is visiting for the holiday. You can still get insured with New York State as long as you have a New York address to provide while you are here visiting on your vacation. A lot of people don't know that. So please share that information as well. So as I mentioned, for the immigrants with the essential plan, you just need to make sure for this one, you do have your documentations that are not expired. Now, if you are changing your status, let's say you are in the process of going to become a permanent resident. So maybe your stuff did get expired. As long as you have a letter from USCIS stating that there is a process going on, you can still get this insurance. As long as you have that USCIS information. So that means your permanent resident card has been expired, your visa expired, but you got that USCIS letter stating that you have a relative petitioning for you. You can, or that you're waiting for them to call you so that you can go do your swearing in or getting your any of your health items, because you still got to go get a physical once you're on your way to becoming a US citizen or naturalized citizen. So that can still redetermine for you to get into this eligibility of getting full coverage. And this is important because unlike the emergency Medicaid, you don't only have to go to the doctor only for emergency purposes. So I want to be clear on that aspect. And if you lose your I-94 arrival departure, that's okay. We will go into the you can go on the actually you can do it yourself too on the USCIS website. You can actually go and look up. Just put in your passport information and remember to use the passport that you came into the country. You go in and you just put in your name, your passport number, and your I-94 is going to come up. So that's what I will use if you do not have it. But like I said, that's for those who just came into the country, but possibly approximately no more than 5 years back, that you can go on the website and obtain that information. And that's what I would do as well. Next slide, please. So due to this pandemic, we are over the phone. We go into the office on a rotation basis. So there's different timing, but if you would like an office visit, we can definitely have that discussion. But right now we are providing a lot of our phone calls, doing remote enrollments, and we are providing all the, like I said, insight into what the process is. And we also have a language line to provide to assist us with anyone who speaks any practically any language. We have the language line, and everything is done through the New York State of Health Marketplace. We would call them and they would connect us with a language person to assist us. So I have assisted people who speak French, they're from Africa, they're from India, they're from the Middle East, anywhere, it doesn't matter. We have been able to assist them if they do not speak English. Um, and one of the great things also is that calling us, I'm also known like as a navigator, a health insurance navigator. It's really best to call us than calling the 1-800 number for the New York State of Health, because we're able to assist with sometimes some folks need a second person rather than getting a language line. They may have their relative or friend who speaks the language and can do the translation for them. And only with us, a navigator, you will be able to do that with, in terms of having someone speak on your behalf. Calling the 1-800 number for the New York State of Health, they do not allow that. Like they need direct contact to the client themselves. So that's a hindrance in calling the 1-800 number, and which is why it is best to, like I said, contact us, the navigators, to assist you with the process. Because not only can we answer questions, and also some questions that you may not want to ask the 1-800 people when you call, we can give a lot of insight, especially when it comes to how you file your information. Uh, it's helpful calling the navigator, and just questions, random questions that you may have. And one of the things, we know that there's a lot of fear in sometimes in terms of speaking over the phone, or not sure about what questions to ask or how to ask the questions you may not want to. So once again, best to call a navigator so that we can assist you. And actually, when you go on the New York State of Health website, it actually puts, you can put in your zip code, and it gives you the nearest navigator that is in your local area. And that could be local within the 5 boroughs, or upstate New York. This health insurance is for the entire New York state. So it doesn't matter if you're in Albany, you're in Binghamton, you're in anywhere, Saratoga, it doesn't matter. The plans differ where you are located, but at the end it will tell you not only what plan you can get into, but also what type of plans is available in your area to for you to determine what you would like. And it gives a description of the plans too, so that the consumer can figure out what is best for them. And you pick. That's the best beauty about this New York State of Health. You get to choose at the end what you want. I don't get to choose for you at all. You choose. So I'm not with one. For instance, the main ones are Health and Health First, Metro Plus, and all the others. You get to determine everything on your own. And the other plan that I was talking about earlier was in terms of the qualified health plan. So that is one for those who are making more money. That is, you're making over 25,000, 60, 70, 80,000. That plan is meaning you're going to be paying monthly premiums plus co-pays. Those plans are called the metal plans. So you have bronze, silver, and gold. And those are a little more costly. That may run you into anywhere into the hundreds, but determine if you have a family structure, that may provide you with an advanced tax credit. And so the tax credit will assist you in making the payment. So that means you only pay the difference. So let's say, for instance, your insurance plan may be $300. They may provide you an advanced tax credit of maybe 150, $200. I've seen somewhere up to 250. So that means you only pay technically $50 for your plan. But it all determines on your family structure, as I mentioned, of what they provide to you. And what's really great is that also completing the application doesn't mean that you're enrolled into an insurance plan. Completing the application only gives you what your eligibility is. That's it. You still have to go and click and say, I want to be enrolled in Health First or Metro Plus or any of the other plan. So that's also important, because some people feel like, well, if I'm unsure, then I don't want to do it. And that's the beauty of you don't, they're not going to do anything. You can't you can't be enrolled without your permission. All of this is your permission. You have the right to state what you want to do and what you don't want to do. And another thing is, even doing the when you enroll into the health plan, you also have choices. You don't even have to stay within the health plan that you choose. You could say, okay, I want to choose Empire Blue Cross Blue Shields. But for some reason, you go to the doctor and you're like, I'm not feeling this plan. They're not giving me, I don't have the full coverage that I need. I thought, for instance, let's say home attendant. Someone may want a home attendant, and they only give you a select amount of uh, visits that you get. And you say, I want to switch. You can switch. There is a time frame. If you are with the If you have Medicaid, for instance, Medicaid will allow you 90 days. You have 90 days to determine if you want to remain in the plan or you want to move to something else. If you do not make that selection, then you stay in that plan. If you are an essential plan, though, essential plan allows you to go beyond the 90 days. So you can call after the 90 days to say that you want to switch into another plan. And the essential plan is a subset of Medicaid, actually. Medicaid gives full coverage, and Medicaid is only for those who are either a permanent resident or a citizen of the United States. That's the only way you can get into Medicaid. But the essential plan is a subset of that. And this is where it has been provided for, like I said, immigrants as well as citizens, just determined on, they have tier 1, 2, 3, and 4. So each of the tiers are determined based on your income information. So that's helpful because you can still pay $0 under the essential plan and see all your doctors with no copays, or you may pay a minimal fee of maybe $20. And the $20 is only for primary care. But if you pay it's about $44 right now, if you get dental and vision, including with your primary care. So once again, that's for the incomes once they're under about 25,000 that you can be enrolled into those plans. And of course, we know Medicaid, you are under the 17,600 roughly, that you can get full coverage with that too. So these plans are available throughout the city, and you can, as long as you select your doctor within network, you're available to go at any of those locations. Next slide, please. So here is the New York State of Health website that I'm sharing. This is where I log into, and we start the application process here. And like I said, even though I am with the Alliance for Positive Change, I am a navigator also for the New York State of Health, and that's the bridge of connection with working with New York State of Health and as well as Aperture, which is another nonprofit organization. So we kind of connect. So look at that in terms of Kwanzaa, in the connection of all the two nonprofit organizations working hand in hand with the New York State of Health to provide this service to the community, so that we could reach, kind of extend our reach in getting to so many people. Next slide, please. So for those that are not eligible for the marketplace, this is any Medicare recipient, unless they have a child under the age of 18, then they can still enroll with the New York State of Health marketplace. However, if not, they cannot come to the New York State of Health marketplace. And that's because they already kind of have coverage. And let me talk a little bit more about the coverage situation. So this is helpful. We saw in the beginning, I stated or reiterated that it's kind of for those who don't have insurance, but there are some people who are they're in hybrid mode, right? Some of you may have been laid off from your job, for instance, and your job tells you, I'm going to give you 1 month of continued health insurance, or maybe 3 months of continued health insurance. So you may start your application process with me, and so your eligibility might not give you the full, we call it the managed care plan, so giving you an additional plan because you're already enrolled in a health insurance plan. Or some folks just say, I do have insurance and I like what I have, but I want additional coverage. So what the state will do will provide you the option to purchase additional plans if that's what you want, since you already have. And it actually reads in the application that you have service somewhere else, you may have coverage. So don't think that you can trick the New York State of Health. They will find out if you have coverage elsewhere, and it will tell me that. And so, and that's, oh, let me say, it may be a reason why you do not have an eligibility at the end. It may tell you that you may have to pay for your health coverage, and immediately that's an indication to me that you have coverage elsewhere. So they do get to pick up that information. But you can once again find out what the cost may be if you choose to still get secondary health insurance through the New York State. You can look through the cost effect and everything for that. And then for those who, as I said, are in that hybrid mode where your job is telling you you only have another month left for receiving coverage with the job, we can start the process. And what would happen is you will, it may tell you based on your income. Once again, all this is relevant to your income. It may tell you we will only provide you with Medicaid, regular Medicaid. So regular Medicaid, that means no managed care plan attached. That means no Empire Blue Cross, no Fidelis, no Affinity, no United Health. You can't get it attached. So what that's one of the beauties of getting this health insurance is because you get the Medicaid with the managed care plan, and the managed care plan is what pays for your insurance, pay for your doctor visits and dental visits and so forth. So once it's stating to you that you only get the regular Medicaid, that means you don't get that. And sometimes not all doctors want someone who only have regular Medicaid because they want to make sure that their service is going to be financed. So this is why we always push to help the client in terms of getting all their documentation so that we can put in for them to get the managed care plans. And in the application, we do put in when the end date is for the insurance plan with the job, for instance. Or you may have a spouse that is providing you that insurance. You can put that in when that end date ends, and then the application would be redetermined. And all your letters and everything, once again, will not come from my agency. It will come from from the New York State Health Marketplace. I saw someone had a question. Please share the question. Oh, am I able to get price for how much I would pay if I wanted to drop my job insurance? Yes, sometimes what they offer through the job is too high and they do not offer any other options. Correct. Yes, you can. You can definitely contact me so that we can go through what your eligibility is. Remember when I stated when we do the application provides to you what you're eligible for. And so it will list you what health plan you can enroll into. And was there another question from anyone behind? Can you share if there was another question that I need to answer? Okay, when you guys get the question, let me know. Um, and for those who are 65 age and over, you will be transferred over to the Health and City Hospital. That's a New York City Care and coverage program. I'm gonna say program. I don't want to say insurance. It's the program that provides coverage for you to seek your medical needs. So that's where the referral is, and I would make the referral. You do not need to call someone else. I would make the referral if you are not eligible for the New York State of Health over to them, and they will contact you to complete your application and proceed on with them. And I'm going to get into that in a second. Um, and once again, immigrants, your income for these plans are under no more than about 25,000, and it depends. Like I said, if you have documentation versus no documentation, that would be the difference in this conversation or statements that these things that I'm stating, right? Um, so just remember that under 25. If you are making over that, because I know there's some of you, you guys have some great off the book jobs, and you're making beyond 30,000. New York State of Health would not be where I would recommend you for. I would transfer you over to the city hospital for services because your income is too high for you can't get emergency Medicaid here, nor can you get the essential plan. And that's only because if you have no, meaning expired documentation, that's what I'm referencing to. If you have no documentation, then you cannot move up into the tiers, as I mentioned, to getting the QHP. So that's a qualified health plan that I talked about, right? Your income is above that 25,000 and you have to pay a premium every month or get advanced tax credit. You're not paying taxes, so that you're not eligible for that. So that is why that part of the New York State of Health you're not eligible for because of your immigration status. And once again, that is the reason why they ask for that immigration status because it identifies what health insurance plan or tier that they put you in, either emergency Medicaid, essential plan, or the qualified health plans, which are the metal plans, bronze, silver, or platinum, or gold, sorry. Okay, next slide, please. And here are the plans that I mentioned so far. I didn't mention VNS and a Medicare, a Fidelis, Metro Plus, United Healthcare, Health First, Empire Blue Cross Blue Shield. And as I mentioned, if you're upstate New York, then those are different options that they provide to you. Upstate, I know, is WellCare, for instance, is upstate New York. So once again, you have coverage for the entire New York State region. Next slide. So one of the fear factors that I am grateful that there's change in this ruling is public charge. So we know that a lot of immigrants were being targeted in this administration about if they receive any federal aid, that they would be a public charge and will not be able to get or move into becoming a permanent resident of the United States. Well, completing this application does not in any shape or form provide you make you be a public charge. The public charge ruling, now that we're going to be having a new administration, they are not going to have, well, we're going to hope that they keep their, keep it as they are saying that they're going to in terms of not having the public charge rule. So this was important because this was a lot of fear that some of our applicants had and wanted to complete this application. This is why I stated in the beginning that people just didn't want to talk to us or were afraid to talk to us over the phone because it's their personal information discussing their immigration status and knowing that we had the I forgot the squad that were going out knocking on people's door and just doing things that put a lot of fear in folks. So with this, the application process, the emergency Medicaid, even though you're hearing the word Medicaid, yes, we know Medicaid is a federal program. However, as an immigrant, you cannot go into that in New York State. And I want to be clear in that your understanding, I'm saying New York State only I'm speaking of. There are some other states where their ruling was different. But for New York State, only if you are a Medicaid recipient is that a federal program. The essential plan that I discussed, the emergency Medicaid that I discussed, is a state plan. You get state coverage, not federal. So that's important to know. So that was something we had to keep enforcing and ensuring folks that those plans are state funded. So you are not a public charge once you're under those two insurance plans. And as I mentioned in the application, it stops you. I can't move forward on an application if your information is not, the information is not being put in correctly for immigrants who are, like I said, if you're unexpired information, we can still put all that information in. It will not put you into a Medicaid. Like I said, you can only get Medicaid if you're a permanent resident. So I like that assurance I was able to share with my clientele that the application wouldn't allow you to go into that tier because you're not a permanent resident. If you're a permanent resident or you're on your way to becoming a permanent resident, then yes, and you have that USCIS letter stating that, then you can be put into that. But other than that, you will not be a public charge because essential plan and the emergency Medicaid are state plans only. And now that we are going to have a new administration, once again, they're stating that this ruling will not be in place. So on that note, I just want to share, if you also have children that you, for instance, were getting federal funding for, because if you go and apply for food stamps, or any housing assist, cash assistance for your children, but you are the head of household as an immigrant, please, that is still available for you to do. Do not, a lot of people were not applying or canceling getting those aids. Once again, you are not a public charge because you have your children that are United States citizens, just that you are the head of household because you're the one filing the application. So I just wanted to share that. Next slide, please. So we are moving into, as I mentioned, the New York City Health and Hospital, which provides practically low cost to no cost in terms of seeking coverage with getting a public primary care physician. The hospital does charge, there are some out of pocket expensive based on the type of service that you need, and that will mean if you are getting some type of special surgery. But other than that, it's based on a scale of what they charge you. You will provide your financial information to them, and they will then determine what you would pay for you are going to see the doctor. And you only pay once you are going to the doctor. For instance, there's no premium as like the New York State of Health. If you are under the qualified health plan, remember I mentioned those metal plans. You don't pay that monthly if you don't go to the doctor under the New York let me just call them the New York Cares program. So that's good to know. But what is great from the conjunction of these two programs is if you have emergency Medicaid and you have a specialty surgery that you need to go and do through the New York City hospital program, you can actually combine. The emergency Medicaid would pay for your specialty surgery that you need to take. So that's good because technically you would have paid for that out of pocket. You would pay a portion of it, right? Because remember I stated with this program, you are paying a sliding scale. So it's great to have both of these programs in conjunction. And you just provide all that to it's called the financial advisor. So I would make the referral over via email or a phone call and provide them with when you want your phone call to be, and then they will give you a call back and you would provide your financial information, your address, and you have to have a New York address and be living in New York for at least 6 months to be a part of this program. Next slide. So you are going to be selecting a primary care provider, but the limitation with this program is that it is only at the hospital that they have selected, which I have the listings that I'm going to speak of. They have member services that is 24/7. So that means you can call 10 p.m., midnight, any of those late hours, and you can request putting in your appointments and so forth, and they have a hotline that they can assist you. Of course, they cannot give you full determination at that time of the night, but at least you can call and they can have someone return your phone call the following day. And you also get access to prescription drugs as well. They provide a card to you. And once again, it's not going to be like one of those managed care plans like Health First or anything where you get the actual card. The card is actually just going to say New York State of Health on it. And it just have your basic information on it, your name. That's why I was stating like it's a program. It's not considered insurance managed care program. It's just a program that they assist for those who do not meet the qualifications of the New York State of Health. And it's also good because though if you receive a eligibility letter from the New York State of Health, I would make that letter be able to provide them with the letter stating you received emergency Medicaid from the New York State of Health, or they're putting you in a qualified health plan that is too expensive and you're unable to pay that. And that is why I'm referencing you over to their program. And those are the two criteria for them to enroll someone with them. You have to be unable to, like I said, pay for it or your emergency Medicaid only. Next slide, please. And here are the locations for the HHC. We have Coney Island Hospital, we have Elmhurst Hospital, Harlem Hospital, Lincoln Hospital in the Bronx, Metropolitan in Manhattan, Bellevue is also in Manhattan, Jacoby in the Bronx, Kings County in Brooklyn, North Central in the Bronx, and Queens Hospital and Woodhull in Brooklyn. So this means only these locations that you have that you can go to. So that's the limitations with coming to this program when you get referred to this location. You cannot go outside a network. You will have to pay for that yourself. Here you will be able to, if you go to another borough or what have you, you can do that here with the New York State of Health Marketplace, that you can go, you can move around because it's within network. Next, please. And this is the website. You can go on there too to check out all their services that they provide in terms of specialty care and so forth. And it's pretty accessible with all the information that is on there. So please go ahead and go on their website as well. Next. So this is just sharing with you again that this is a conjunction with New York State of Health and the city. This is actually the logo of the card that they're going to send to you, where it says New York Care. That's exactly how the card is going to look like with just your name on it. Next. Uh, all that we know with New York, with the city hospitals, all the insurance is accepted there. So Metro Plus, Health First, they take a plethora of different insurance plans. Um, and you can get coverage again. Remember, this is where those over 65, this is where they get reference to. Next. This is our contact information. So this is where these are other team members of my team. I have my assistant director, Ms. Marcia Dare. Myself, I am the manager, and my two assistant managers, Diamond Walters and James Rivera. We are very quick with answering our phone calls. So you are able to contact us at any time and immediately. So once again, I hope that this information was great for all of you guys and that you are able to take this and share with your community, friends, family. We are here to assist you in any way, shape, or form. This is our office locations. The Alliance has six. We have all in Manhattan except one, which is our housing in the Bronx. But our main office is the Midtown Central, which is on 35th Street between 5th and 6th Avenue. That's right by Herald Square, Macy's, down in Midtown. That's the largest office that we have, and the other ones are our smaller offices. The Washington Heights office in Upper Manhattan. Lower in East Side is our Keith Haring office, and we have our substance use location, which is down in Lower East Side in the Chinatown area and near First Avenue. So there's many ways that you can contact us and be a part if you need additional services.